WCNC Charlotte, this is Flashpoint.
Thanks for joining us here on Flashpoint. I'm Ben Thompson. Healthcare for thousands of people here in North Carolina could soon be on the way. This week, Governor Cooper signing the Medicaid expansion bill into law. It's something that's been years in the making. Republicans eventually swayed by nearly $2 billion in federal incentives. And now some 600,000 folks could get the care they need. Joining us now is the U.S. Secretary of Health and Human Services, Xavier Becerra. Secretary, thanks for coming on. We appreciate it.
Absolutely, Ben. Thanks for having me.
So this week, a big deal here in North Carolina this week, becoming one of the last states to finally expand Medicaid. We've talked about it for about 10 years now. Given that most states have already done this, given the fact that you sort of are aware of how these things go in all 50 states, what is this going to mean for those 600,000 people here in North Carolina who finally have access to affordable health care?
Ben, perhaps there's no better way of saying it than to say to those 600,000 Americans in North Carolina, to the governor, to all the legislative leaders, you've just given people peace of mind. To all those people who today know that if their child all of a sudden becomes deadly ill and needs to go to a hospital, you don't have to worry anymore. If I take my child to the hospital, will I not have the money to pay the mortgage or my rent? Will I go bankrupt? That used to be the case, and a lot of folks would have to weigh those decisions and sometimes not go to the hospital or not buy the medication. Today, 600,000 people have the peace of mind to know that they can take their child to the hospital.
For our friends down in South Carolina, which, by the way, only about 10 miles from where I'm sitting here in Charlotte, they have not expanded Medicaid. What else do you think needs to happen to get those last few states on board?
40 states have given millions of their residents the peace of mind. But you're right, there's still 10 states in America who have not. And it's crazy to believe, but there are still millions of Americans who don't have the opportunity that their fellow Americans just across the state border have to have that peace of mind. It's not something we can afford to do, and it's not something a country as great as America should do.
Switching gears now, this week the FDA approving the over-the-counter Narcan. It's a drug that can reverse overdoses. It's been talked about for quite some time. How do you see this changing the game when it comes to overdoses here in America?
Oh, it's like getting 3 new strikes when you're at the plate. We know that a lot of people are dying today because they don't realize that the drug they're about to ingest or inject is laced with deadly fentanyl or other drugs. And what happens is you have younger and younger populations that are dying from overdose. Narcan is one of those drugs that helps offset. It reverses what some of these deadly drugs like fentanyl can do, what opioids, can do, and it could save a life. Now, the fact that you can get it over the counter will make it far easier for some of these folks who are still using drugs to save a life, or for a family member or a friend to be able to save a life. It will change. It is a true game changer, but we have to make sure that it's done right. And so for that reason, we want to make sure when it gets on the market, it's affordable. When it gets on the market, it's easier to understand where to get it. And when it gets on the market finally, we make sure there's accountability to make sure it's being used the ways we want it to be used.
Let's talk about insulin prices. 3 of the major producers of insulin announcing caps at $35 a month. It's something that the administration, I know, has been working hard on. But it's just one of, as you know, many extremely expensive drugs. Help us work this out. I realize this is different, but at the same time, I know folks at home want to understand, why can we not apply this same sort of thing and scale it to, say, other prescription drug costs?
Well, Ben, they're right. There's no reason why we shouldn't. And so that's absolutely the correct question. Why are we doing it for insulin, but not for so many other drugs that we need that are so expensive? And that's the answer. That's the question that the president answered by making sure we passed his new prescription drug law that will lower the cost of prescription medication.
Let's talk about COVID. Here in a little more than a month, the public health emergency is set to end. I know while vaccines will remain free, I think coverage of some of the over-counter tests will end. Are you worried that this will lead to less testing and potentially more people going to work, school with the virus? Or are we now saying as a country, okay, that's a level of micromanaging this virus that we're not going to do anymore?
Well, I'm hoping that what happens is, because we are at a different place than we were 3 years ago with COVID, that we can say that we're no longer in a state of emergency that we can't control, but that we know how to control. We know how to manage COVID. And having learned how to manage COVID, vaccination, distancing, masking where necessary, that what we'll do is we will put it as into part of our routine, just the way we will get the flu vaccination, just the way we ask our kids to get vaccinated for measles and for smallpox and the rest. We're going to try to move America towards putting this part of their routine to protect against COVID. And the best way, of course, is to get the vaccination, stay updated. So it's going to get to the point where we hope it will be once a year for most Americans, get that vaccination, and you're in pretty good shape when it comes to COVID. Obviously, continue to be smart, don't do crazy things. But that's where we hope we'll go, Ben. But the bringing down the public health emergency means that we're in a better place, but that still means we have to work hard to protect ourselves.
Does this mean the end of folks needing to necessarily quarantine anymore?
For the most part. Remember, we still have Americans who have low immunity because of they may have cancer. They're taking drugs that lower their immunity, make it tough for them to fight off those types of viruses and diseases. And so we always have to protect our elderly loved ones who are not as strong anymore. Our children sometimes can have certain diseases. So there's always going to be a case where we have to be careful. Quarantining would be one of those examples where it's a severe example of how we try to protect ourselves from those who might spread a disease. But for the most part, as I said, we've learned to manage COVID so we can move away from some of the more dramatic measures that we had to take before.
Finally, let me ask you, it's not exactly your wheelhouse, but you are Health and Human Services, and we've saw once again this week that there's gun violence, the #1 killer of children in America. Your thoughts on our inability as a country to tackle this problem?
Well, we have the ability. We just have to be willing to use the wherewithal we have. And unfortunately, from my personal perspective, we haven't. I consider, we at the Department of Health and Human Services consider gun violence a healthcare crisis, because it impacts not just those who are the victims of gun violence, including up to death, but it hits every family member. And I must tell you that today Americans are suffering by the death of children at the hands of someone wielding weapons of mass destruction. And I would say that it's time for us to realize that we have it in our power to reduce gun deaths. We just have to be willing to take some of those actions and keep those weapons that are not meant to be principally defensive or for hunting out of the hands of people who are using them in a way that kills our loved ones.
Are you optimistic that anything will change anytime soon?
Look, I'm always optimistic. I'm the son of immigrants. And so I do believe that this country will learn. And sometimes we take a little while to learn, but that's the beauty of America. We move forward, we learn, we don't want to go backwards. And I think we see that we should not be the king and queen of gun violence in the world. And we will learn, because it's our children who are suffering because of our inaction.
U.S. Secretary of Health and Human Services, Xavier Becerra. Secretary, thanks for coming on. We appreciate it.
Thanks, Ben.
All right, take care. Well, the primary for North Carolina governor now less than a year away. Coming up next on Flashpoint, the first Republican candidate to announce his bid for the governor's mansion.